Proper donning and doffing of personal protective equipment, or PPE, is one strategy to minimize the transmission of communicable diseases in order to keep you and our users safe. In this video, we will review how to don and doff PPE when contact droplets airborne precautions are required. The instructions in this video provide you with safe practices that are also applicable for emerging pathogens causing severe respiratory infectious diseases. Now let's start. Before entering the room, you need to remove personal items such as rings, dangling earrings, watches, cell phones, pagers, and pens. Make sure your hair is tied back. Ensure you're wearing shoes similar to a well-fitting walking shoe or running shoe with a closed toe and closed heel. Crocs are not recommended. Shave your beard if applicable. Ensure the following equipment is available: hand sanitizer or soap and water, gowns, gloves, N95 respirator, face shields or goggles. Next step is to perform hand hygiene. This should take you 20 to 30 seconds to complete. Apply a palm size of alcohol-based product to a cupped hand. Rub hands palm to palm. Rub the back of each hand with the palm of the other hand with fingers interlaced. Rub palm to palm with fingers interlaced. Rub with back of fingers to opposing palms with fingers interlocked. Rub each thumb clasped in palm of opposite hand using rotational movement. Rub tips of fingers in opposite palm in a circular motion. Rub each wrist with opposite hand. Once dry, hands are clean. Wear a gown fully covering yourself from neck to knees. Surely fasten the ties at the back of the neck and then the waist. Ensure your back is entirely covered. Choose the appropriate N95 respirator that you have been fitted for. Inspect the respirator. Open the respirator fully. Cup the respirator in the palm of your hand, the nose piece at your fingertips. Position the respirator under your chin with nose piece up. Pull top strap overhead, resting it on the back of your head. Pull bottom strap overhead, resting it around your neck below the hairline. Using two hands, mold the nose to ensure there is a good seal. Refrain from pinching. Place both hands over your respirator and exhale sharply. If you feel the air, it means your respirator needs to be adjusted. Next, wear the face shield to cover your face, making sure the foam band is resting on your forehead and the elastic strap is fitting well behind your head. Put on gloves and extend the cuff to cover the wrist of isolation gown. Now you're ready to enter the room. The doffing process poses the highest risk of transmission to healthcare workers. Make sure you take your time removing your personal protective equipment. Before exiting the room, here are the steps. Untie the waist. Remove the gloves. Grasp the outer surface of one of the gloves by pinching it at the heel of the palm. Remove the glove from the palm by pulling it towards your fingers and turn it over itself. Roll it in a bundle and keep it in your gloved hand. Slide your bare index finger and middle finger under the strip of the other glove without touching the outside. Remove the glove from the palm by pulling it towards the fingers and turn it over itself. Discard gloves. Perform hand hygiene. Remove the gown without contamination. Unfasten the gown at the neck. Hold the neckties in your hands and slowly pull the gown forwards. Grasp the inside of one sleeve, slide it off without flipping it over to free the hand. With the free hand, proceed in the same way to remove the other sleeve. Roll the gown into a ball and avoid touching the outside. Discard right away. Now you are ready to exit the room. Perform hand hygiene. Remove face shield or goggles. Lean slightly forward. Grab the strap of the face shield from the rear and pull it toward the front. Avoid touching your face. Discard right away. Remove the N95 respirator. Tilt your head slightly forward. Use 2 hands to pull the bottom strap over your head. Maintain the hold on the first strap. Use the other hand to grab the upper strap and pull it over your head to keep tension on the upper strap as you remove it. Holding the respirator by its straps, discard respirator immediately. Perform hand hygiene.
You may perform hand hygiene at any time if you feel you contaminated yourself during the doffing process. Please call the Infection Prevention and Control Team should you have any questions or concerns with donning and doffing.